tragic new numbers on the pandemic and the heartbreaking human toll. Yesterday, the United States had the single deadliest day since this pandemic began. More than 3,100 Americans died from the coronavirus. Now, that shatters a previous single-day record, and that was set back in April. Hospitalizations are also at a record high, above 100,000 nationwide.
Up to 180,000 more Americans could die in the next 8 weeks without more precautions, according to the head of the CDC. Dr. Robert Redfield warns this winter will be the most difficult public health battle in U.S. history. Local officials are split on how best to respond. Our lead national correspondent, David Begnaud, is following this. David, let's start in Los Angeles, which is reintroducing strict stay-at-home orders.
Yeah, look, Anthony, a lot of people got a text message alert telling them to stay at home, and some people were confused. I mean, it almost sounded like lock yourself inside and don't come out. It is a very strict order. New guidelines issued last night by the mayor, who says he will vigorously enforce this order. But there's a long list of exceptions. Watch.
My message couldn't be simpler. It's time to hunker down.
With more Los Angeles residents infected with coronavirus than ever before, Mayor Eric Garcetti issued what's called a targeted safer at home order for everyone in the city, directing them to remain in their homes.
It's time to cancel everything. And if it isn't essential, don't do it.
Now listen, there are tons of exemptions, not only for essential workers, but also for those who need to keep non-essential businesses running, including retail stores and restaurants. Also exempt from the order are faith-based services and protests. Now, the number of Californians hospitalized with COVID-19 hit a record high for the 4th straight day on Wednesday. This is as hospitals around the country are bracing for a surge upon a surge, as it's called, because of holiday gatherings recently.
December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation.
And those concerns have some people pressuring the FDA to move faster on approving a vaccine. But Commissioner Stephen Hahn told CBS News his agency will not cut any corners.
What we're going to do is actually crunch the numbers ourselves, look at safety, look at efficacy, and we're going to do that line by line.
After approval, Operation Warp Speed hopes to have the Pfizer vaccine out the door by December 15th. With doses allocated to states by population. For example, some 300,000 to California, 170,000 to New York, 19,000 to Minnesota, and 12,000 to Maine. Among the first people to get the vaccine are frontline health workers, like Dr. Kurt Poppenfuss. He is the only full-time doctor treating about 900 people in Cheyenne Wells, Colorado. So when he contracted the coronavirus in late October, his hospital had to scramble to replace him.
I'm the clinic doc, I'm the ER doc, and I'm the hospitalist when I'm on call. You know, I do everything.
I get the sense that even though you are recovering and you should be in bed resting, you probably feel a sense of guilt.
Yeah, it's almost like survivor's guilt in a way. I guess it took 5 different doctors to cover me in 1 week. If all your healthcare docs are like me, then what the hell are you going to do?
Talk about a doctor in demand. Listen, the good doctor was telling us that he feels a real brain fog right now, almost like he's kind of drunk. And what they told him was, you will not be able to go back to work until we can do a test of your cognition skills. Tony, he is still getting up to speed with the long-term effects of having had the coronavirus.
Very troubling, David. Thank you very much.